Welcome, everybody. Thank you for joining us today for our webinar titled NCUIH Presents CAWI on how to quickly assess infection control information and provide effective training during emerging and re-emerging disease threats, a panel discussion with subject matter experts. As a note, CAWI is a Comanche word for gathering, so we are grateful to gather with you all today. Next slide, please. Welcome, everyone. We are very pleased that you could join us today for our fourth Project Firstline webinar session. Today's session will wrap up this year's webinar series by providing a recap of NCUIH's Project Firstline trainings, gaining feedback from UIOs on trainings and resources through a virtual dialogue, hosting a panel of Project Firstline subject matter experts for a discussion and Q&A, and providing cultural commentary. We will also ask that each of you enter your name, organization, tribal affiliation, and professional title in the chat. Next slide, please. All right. Please note that this session will be recorded for educational and quality improvement purposes. Next slide, please. Please feel free to turn on your videos, mute your microphones when you're not speaking, and ask any questions using the chat box. If you have any IT difficulty during today's call, please send a direct message in the chat to our chat monitor, Alyssa Long, and she will assist you. Next slide, please. All right, for today's agenda, or for today's session, our agenda includes welcome and introductions, storytelling, a recap of Project Firstline at NCUIH, a virtual dialogue to collect key feedback from you all, a panel discussion, a cultural commentary, and our wrap-up to close the session. Next slide, please. NCUIH is a national nonprofit organization devoted to the support and development of quality, accessible, and culturally competent health and public health services for American Indians and Alaskan Natives living in urban areas. NCUIH is the only national representative of the 41 Title V UIOs under IHS in the IHCIA. NCUIH strives to improve the health of over 70% of American Indians, Alaskan Natives, populations that live in urban areas supported by quality, accessible healthcare centers. NCUIH strives to create a broad awareness of Indian health issues while maintaining a visible presence in DC. We track legislation and provide congressional testimony, as well as distribute news, resource updates, and legislative alerts. We hold conferences, webinars, and host an interactive website that helps to disseminate information and facilitate partnerships. Next slide, please. We would like to thank the Centers for Disease Control and Prevention for their continued support. Project Firstline is a nationally collaborative led by the CDC to provide infection control trainings and education to frontline healthcare workers and public health personnel. NCUIH is proud to partner with Project Firstline. The contents of this program do not necessarily represent the policies of AAAHC accreditation body, OSHA, CDC, or HHS, and should not be considered an endorsement by the federal government. Next slide, please. To speak a little more on Project Firstline, this National Training Collaborative for Healthcare Infection Prevention and Control, or IPC, aims to provide foundational and practical knowledge directly to more than 6 million frontline healthcare personnel and targeted components of the public health workforce to protect the nation from infectious disease threats, such as COVID-19. With emphasis on empowerment, collaboration, and lasting results. Next slide, please. All right, our objectives for today's session are to recap Project Firstline training events to summarize and reinforce key messages and concepts, encourage discussion between audience members and a panel of Project Firstline team members and subject matter experts, SMEs, obtain key feedback from UIOs on infection control and trainings, IPC, resources, and needs, and highlight and share Project Firstline training content, resources, and opportunities. Next slide, please. All right. We would appreciate it if you could all complete a brief survey on today's session so that we can continue to improve our presentations. Here you see examples of some of the questions that we will ask you in the brief survey. You can see a QR code on the screen that will lead you to the survey. This QR code will be found in the bottom left corner of many of our slides today. So feel free to scan with your phone to have it ready. The link to the survey will also be shared in the chat, and those who complete it will have the chance to receive a token of appreciation from NCUIH in the future. Next slide, please. All right, I am Kyle Mitchell, and I will be your host for today. Today's panel, we will have Dr. Abigail Carson, Shay Drummond from the CDC, Dr. John A. Poorman from RTI International, and Karen Wonk from the NCUIH Project Firstline team. We will hear more about all of them later during today's presentation. Next slide, please. All right, so I wanted to just share a brief little story for those of you out there in our audience today. It starts with CUIH, right? The meaning to gather, to be in a space all at once. And so when thinking about that, I thought of Kohaki. It was a place here in the Americas, here in Northern America as we know today. But prior to our first contact, it was the most robust trade town and the largest city constructed north of Mexico City. And during that time, there was tribes all around the nation and all around the world that traded with their needs and followed up for information and kind of met with that same CUIH gathering that we're having here today. In addition to that, people were able to share information, gather food, get materials, and do all of these things. And that civilization, that city actually flourished, and those trade routes flourished and are sometimes still seen today in a very parallel. So if you travel east to west, you'll notice the I-40. Before the I-40, there was a Route 66. Before the Route 66 were all the trade routes that were used by the indigenous tribes back in the day. In addition to that, once 1492 happened, that really shook up everything. That made our world go upside down for American Indians. But it wasn't until a few hundred years later that we were able to reestablish ourselves here with the new founded United States. And in September 7th of 1953 is when the first ever American Indian Center was created in what is Chicago today. Fast forward a little bit more, in 1955 was actually the first time that we created the IHS system here in the United States. And so the reason why I wanted to share that a little bit about Kohaki and a little bit about CUIH is because what you see right now with UIOs in your spaces, in your urban environments, are replications of that. So granted, not all tribes or ancestral lands are close to the metropolitan areas that inhabit the urban populations you serve. So the Indian centers around the nation are a gathering. But more intimately and more focused are actually the UIOs, because everybody needs healthcare. We've all seen from COVID-19 on what can happen and how fast information can be disseminated. And so we have fine-tuned those keys with a lot of other procedures, organizations to iron everything out. So today, thank you very much for joining us, because all of the information that you're gathering today, all of the questions that you're going to be answering, all of our subject experts, are all things that you can take with you back to your community, to your frontline workers, to share with the people, and to keep in line with that CUIH thread to gather together, exchange information, and then take that information back to your community. So before I switch it off to Sophie, I wanted to close off very briefly and just end this little tidbit with a quote from Wilma Mankiller. That quote is, "The secret to our success is that we never, never give up." And so thank you for being here today and never giving up on your pursuit of knowledge. So thank you for being here today and enjoy the rest of the webinar with us. Sophie, now to you.
Wonderful. Thank you, Kyle. Next slide, please. So now we're going to provide a recap of this year's Project Firstline events at NCUIH. Next slide, please. So during this grant year, NCUIH hosted a series of Project Firstline webinars and a series of Project Echo events. So today's session is our last webinar in this year's series. We're going to do a quick summary of all of this year's events to reinforce key learnings from these events. Before we go on, we'd like to ask you if you attended any of these events. So you should now see a Zoom polling question appear on your screen. Please select all of the events that you can remember attending this year. And if you did not attend any of these events, you can ignore the polling question until the poll ends and then add none of the above in the Zoom chat. And we'll leave this up for about 30 seconds. So we appreciate any feedback you all can share. All right, we'll give about 10 more seconds to respond. All right, I think we can close the poll now. So thank you all for completing that poll. We appreciate everyone who took the time to attend these events, and we look forward to seeing you at future events. Next slide, please. So this year's Project Firstline webinar series was called Infection Control in Healthcare Amidst Emerging and Re-emerging Disease Threats along with COVID-19. From these 4 webinars, including today's session, you can see that the key takeaways included how infection risk recognition involves spotting opportunities for germ spread and taking action to stop the spread of germs, how reservoirs are places where germs live in our bodies and the environment, how 4 common body reservoirs are the skin, gastrointestinal system or gut, the respiratory system, and blood, how there are 4 reservoirs in the healthcare environment that are important for infection control, and those include water and wet surfaces, dry surfaces, dirt and dust, and devices. And finally, how pathways are ways that germs can spread from one reservoir to another or to a person in order to infect them. Next slide, please. And this year, NCUIH also hosted a series of Project Firstline events for the Extension for Community Healthcare Outcomes Program, or Project ECHO. This telementoring program aimed to bring providers and experts together through communities of learning. From these 6 echoes, the key takeaways included, again, how reservoirs are places where germs live. Common reservoirs where germs live include the body, like the skin, gut, respiratory system, and blood, and the environment, like water and wet surfaces, dry surfaces, dirt and dust, and devices, and how pathways are ways that germs can spread between reservoirs and to people. So you can see here that there is a lot of overlap in these key infection prevention and control concepts across both of these series of events this year. So thank you all for taking the time to hear some of those key learnings. I'll now hand the floor back over to Kyle to move us into today's virtual dialogue. Thank you.
All right, thank you, Sophie. All right, now we're going to move into our virtual dialogue. Alyssa Long, who works as a public health associate and the interim senior project manager at NCUIH, will help me lead you through a series of questions to gain insight into your perspectives on infection prevention and control trainings and resources. Next, let's see. Okay. All right, here's the Poll Everywhere. We will be using the platform Poll Everywhere for this discussion so that you can see everyone's responses to each question in real time. Please note that your responses are anonymous. Even if you prompt to choose a screen name to participate in the poll from your computer, you will visit poll.ev.com. Put that in your internet browser and then enter in all caps WIRED, W-I-R-E-D, SUN, S-U-N 334 to join the poll and respond. You can also use your phone to participate by texting WIRED SUN 334 to 22333 or by scanning the QR code you see here. We will pause and give you a second to read these instructions and scan the QR code if you would like. And we will also add these instructions in the Zoom chat. All right, so once again, you have three options. You can scan the QR code, do it from your phone. You can type in the address there into your web browser, or you can text. So any one of those options are available. All right, now we will move on to our poll. You can continue to join the poll as we go through these questions, so don't worry if you're not finished joining the activity. All right, next question. All right, so our first question for today is, how much of today's training information was new to you? Please try to estimate the percent of the content on Project Firstline NCUI's training events feels completely new to you. All right, good. We got a few things. Oh, great. It's good to see a few of the 100%. Look at that.
And if you weren't able to access Poll Everywhere, you can always put your responses in the chat as well, just with the corresponding letter or the percentage. So it looks like 50% is the win right now. Somebody's been to all of them. We have some responses for all.
Ooh.
You can also come off mute if you wanted to share more or elaborate more on the sessions you went to. Does anyone who went to all the sessions want to come off mute? I think we have a shy bunch, Kyle.
Okay, no problem. I guess we can go to the next question. All right. Okay. Which of the aspects of Project Firstline products were most beneficial for infection prevention and control or IPC training? And here you can select more than one answer to help us identify what aspects of Project Firstline content and events have been most useful for your training and your colleagues or your staff on IPC. All right, webinars seem to be winning. Okay, echoes. Oh, echoes and informational resources are tied. Huh. Podcast, 13%. Oh, good. And nobody answered E. Round of applause for everybody. That's always a good thing. All right. So do we have any brave volunteers that want to share maybe one or two maybe things that stood out within either the webinars, the echoes, the informational resources, or even the podcasts? Feel free to unmic. We're here to be engaged today, so please feel free to let us know some of your feedback.
I'm really interested further to know what percent of our UIO frontline staff were able to have access to the podcasts. That's something we really created this year. So it's not, I feel like it's not fully saturated yet with our UIOs and the staff. So that'd be something to kind of look into further down the line as well. And its effectiveness as far as delivering, resource information or training information.
All right. Okay, we can move on to the next question? Does that work? Okay. All right, next. How has Project Firstline helped you address any organizational challenges or barriers in implementing infection prevention and control, or IPC protocols? This is a free response question, so you can type up to 500 characters here. And if you run out of room, you can unmute yourself and respond aloud or respond in the Zoom chat.
I just wanted to point out a comment from Veronica. I think it might have been from the last question, but she mentioned that I did not have access to this project until last month.
Oh, wow. Well, thank you for sharing that feedback with us, Veronica. Appreciate that. This is my first attendance to the project. Great.
As a follow-up to that, while people are thinking, from the CDC end, we're interested in this as well, as I know NCUIH is. Veronica, if you have other comments about where you think you might have, where it would have been helpful for us to show ourselves, where it would have been helpful for us to be presented and have access. If you have any thoughts as to where you would have usually looked for us that you didn't find us until now, that you'd like us to be in that space or that place, we'd be very interested in hearing your thoughts as well.
Can you hear me?
Yes, indeed. Go ahead.
Okay. So what actually drove this toward me was that our urban clinic was working on, IIIHC certification and HRSA and many of these certifications we were working on, but nobody here has seriously gone through an IPC program. And so this was actually, I didn't even know this program was in existence until one of the other managers had said, oh, you might be interested in this. And like I said, this was like about a month ago. You might be interested in signing up for this. And I read it and I thought, okay. So I thought, oh, they obviously were sending it to the wrong person. So that's how this developed for me. And I thought, I wished I'd been involved in this a whole lot sooner, because I would have been a lot more progressed in these goals.
That's very helpful. Are there any websites or email listservs or social media accounts or work-related email lists that you use regularly that you feel, oh, this would make sense if it had been advertised here, or if I had seen it as part of this?
Well, I'm on a lot of listservs because, I am a nurse and in a urban clinic, but this particular, the NCUIH one, I've never been involved with. I didn't even know it existed until now.
Thank you. That's very helpful. I see a lot of other people commenting on this as well. If others have other thoughts, at least from my end, and I think from NCUIH's end as well, we're very interested in hearing.
Yeah, I can step in and read the comment from Channelie, saying, our safety infection control committee, I'm new to this committee and they shared this with me to attend. Not well informed. I was told 2 days ago about this. Well, still, thank you for attending our last session, and we usually upload our sessions on YouTube, and we're also in the process of getting them on a separate website, so there'll always be a chance to watch, but we're happy that you joined for our last session. And then we also have Diana, who said, I have been on all the trainings and has helped Bakersfield, the American Indian Health Project, in many ways to develop our COVID surge plan to in-house trainings. That's great to hear, Diana. And if either of you want to come off mute and share more, you're more than welcome.
Hi, can you guys hear me? This is Jimmy.
Hi, Jimmy.
Hi, so I was the infection preventionist for Pine Ridge for the Pine Ridge Service Unit in South Dakota. And a lot of the times when I get my trainings that I jump on, it's usually from CDC has a listserv that goes out for a lot of it right now is monkeypox, to be honest, that they send out calls for or invites to Zoom calls for. Another one that I know that I get a lot, like listservs, is there's an IPC listserv and an infection control listserv for IHS. A lot of stuff that comes through there is how I learn about a lot of trainings and stuff like this that I would absolutely love to attend. I am now the infection control project coordinator for headquarters for IHS. So that infection control listserv I will be one of the administrators for. So like stuff like this, I would definitely love to be sending out on that listserv eventually once I kind of get my toes a little bit deeper into the water here.
Thank you, Jimmy, for sharing that. And we'll also share our email as well at the end if you ever want to reach out to us and have any questions on how we can make sure that you're getting access to that information.
Thank you.
Also, people on the call now, if it's your first time, please share it with your colleagues, your network, and other UIOs you connect with too. So this is open to all of our urban eating health organizations and frontline staff.
I think we can probably go to the next question. What do you think, Kyle?
Yeah, that works. Okay, next question. Nope. All right, so question number 4. Finally, as we follow up, as a follow-up question to our previous question, what Project Firstline products would you recommend to other UIOs and external agencies? And here you can select more than one answer. So if you just reflect a little bit on what helped you or your organization and what you think would help other organizations out there or other agencies for that. Oh, great. Webinars and informational resources. Good. Can somebody elaborate on one of those for us, just so we give the rest of the audience some feedback from the practitioners on the front line?
Hi, this is Ronnie Whitehorse calling. I think that for me, a webinar or some sort of presentation like this gives me the opportunity to be able to set aside time to be able to engage in this instead of, I see a lot of patients on the side, or I'm trying to do other duties as assigned while throughout the day. And this way I can actually close off and concentrate on this kind of training. So as far as podcasts go, I mean, that's a great thing, but sometimes I can play those in the background and they're a little bit hard to absorb because of they're playing in the background, and I'm usually running around doing other things too.
All right. Thank you, Veronica, for that feedback. Appreciate that. All right. Would anybody else like to give us some feedback on their recommendation?
All right, I think we can probably go on to the panel.
All right, sounds good. All right, everybody. Well, thank you very much for your feedback. We're always looking for valuable insight to improve our Project Firstline activities to best address your needs. If you have any additional feedback on how NCUIH can improve our Project Firstline content, please feel free to share that information with the address that was dropped in the chat, and further on into this webinar, you will have opportunity to provide additional feedback. So with that, we will hear from today's panel of subject matter experts and Project Firstline team members. Next slide, please. All right, so now we will have each panelist introduce themselves and share their name, organization, and role with Project Firstline, starting with Dr. Carlson.
Hi, everyone. I'm Abby Carlson. I am an infectious diseases physician and a healthcare epidemiologist by training, which is essentially the physician version of an infection preventionist. For those of you who are new to infection control, I work as the subject matter advisor, one of two. Shay will be the other one introducing herself, but for Project Firstline at CDC. So a lot of the materials that we create, the content part, the technical part, starts with Shay and I and our wider content team. So that is me. Welcome, everyone.
Great. Thank you, Dr. Carlson. Shay, would you like to introduce yourself to the audience?
Sure. Good morning, everyone. I'm coming to you from Eugene, Oregon, so it is still morning here. As Abby said, I'm part of the content team. I'm a registered nurse and a certified infection preventionist, and have had many, many years in the infection prevention and control world, starting as a frontline infection preventionist and moving up to manage a large team of infection preventionists. So I have real world experience of the challenges that we all face, no matter what your role in the healthcare system. So it's a pleasure to be here. Thank you.
Great. Thank you, Shay. Dr. Pullman, would you introduce yourself, please?
Greetings, I'm John Pullman. I'm a health communication scientist at RTI International, and I lead a team that's been supporting CDC in developing Project Firstline training and promotional resources. In general, the team that I work with helps design, develop, and deliver health communication interventions, campaigns, and materials. And as a background, I am an applied anthropologist who has been doing social marketing work for about 19 years.
Great. Thank you very much. Karen, would you introduce yourself to the audience, please?
Thank you, Kyle. I'm Karen Kwok, and I'm a nurse practitioner and contractor with NCUIH Project Firstline's collaboration with CDC since November 2020, and I've had the great opportunity to serve American Indian communities on the front lines. Thank you.
All right. Thank you very much. I will now hand the floor over to our RTI and CDC panelists who have prepared a brief presentation for you all.
Great. Well, I'll kick us off. If we could go to the next slide. Yeah, so we just wanted to, start with kind of sharing a little bit of orientation to the work that we've been doing. To us, it's been clear from the start of this project and us RTI working and supporting CDC that the resources that we're developing for healthcare workers that include, nurses, medical assistants, and environmental service technicians, that they should be driven by understandings and insights from those audiences. So involving healthcare workers through engagement and co-creation activities has been sort of a central philosophy of this work. And so in our role assisting CDC with the development of new Project Firstline resources, we've used interviews, focus groups, we've conducted a human-centered design study, and really just sought as many ways as we can to engage healthcare workers in our work with the goal of better understanding their training needs. And through this engagement, we've gained insights that's made us better understand things like how to effectively promote Project Firstline materials to our audiences, and then, engaging with them on, how to create learning products that are aligned with workers' needs and preferences, so that these are useful and things that they'll be able to easily access and use in their sort of everyday. So can I go to the next slide? So I'm just going to walk you through or share a few of the steps we've taken in supporting Project Firstline to engage audiences. Next slide. Yeah, so one of the first things we did, was think about how we could address the training needs of frontline healthcare workers, and knew that we needed to think differently about this, especially as we were trying to approach this during a pandemic. So one of the things we did was do a human-centered design study to better understand healthcare workers, infection control education and training experiences, their needs and preferences. And to do this, we engaged the Public Policy Lab, a nonprofit policy design organization that helped facilitate the study. And here you'll see the principles that Public Policy Lab applies to its work. And really, in thinking about the work we did, we focused primarily on these first two, human-centered and co-creative. While our focus was primarily on developing deep insights into healthcare workers' needs through a human-centered design process, we were also excited to engage with healthcare workers in a co-creative fashion to get their input on what future trainings could be like. So trying to kind of understand their needs from their perspective, understand it in with empathy, and trying to understand the jobs and challenges that they're taking on every day, and also get their input and their ideas for how we can make trainings better. So if we'll go to the next slide. So these are the 4 research questions that we identified to kind of drive our human-centered design study. So how do healthcare workers currently receive their IC information and training? How are healthcare workers trained? What are healthcare worker training needs? What are IC training opportunities and constraints existing in healthcare workers' lives? And what are healthcare workers' preferences for receiving new information on IC? And so, driven by these questions, over the course of the summer of 2021, we then engaged with 21 healthcare workers in a set of design sprints to learn more about their work and experiences with infection control, as well as to get their thoughts on how new trainings could be delivered. Can I have the next slide? So some of the kind of key findings that came out of this is that, we understood that healthcare workers seek a knowledge ecosystem to support infection control learning, but are instead often faced with uncoordinated learning touch points. So there seemed like a real opportunity to create new systems that could help better address their learning needs. Healthcare workers seek trainings that put the right information in the right place at the right time. One of the findings was that often trainings are unstandardized and disjointed, or may be done at a time when it's not as relevant to the work that they're doing, and that there could be some opportunities about further aligning training with actual work. Also, that content doesn't reflect current lived work experience, and personal values will fail to become applied knowledge. So we really need to understand the experience of people, doing the work in order to make those connections, or it's just not going to connect with them. And then finally, IC engagement falters when healthcare workers don't believe expanding or updating their infection control knowledge are instrumental to their professional mission. That we need to make sure that this aligns with a feeling of personal growth or opportunities for growth. So using these and other insights, RTI worked with CD to develop products for launch that address and reflect these principles. We'll go to the next slide. So in addition to the work that we did with the Public Policy Lab on human-centered design, RTI tested numerous projects with healthcare workers to get their feedback. As part of this work, we've developed a set of recommendations that serve as a heuristic in designing new products. and, really emphasizing some do's and don'ts, and these are not absolutes, but just things that can help us think about what we should be doing when we're developing materials. And we'd be happy to share this with NCUIH to disseminate further. But things are like emphasize the need for teamwork in infection control, relay the impact of infection control on patients, emphasize healthcare workers are more than any single role or infection control action, show the diversity of the healthcare workforce in terms of gender, race, ethnicity, age, and profession, and address a variety of infection control actions, use modern, fun, and happy imagery, and use video ads. In terms of our sort of don'ts, don't apply healthcare workers lack an understanding or experience with infection control. Don't suggest infection control is the sole responsibility of healthcare workers. Don't use imagery showing improper infection control, like incorrect PPE use. And don't use complex language that may be inaccessible to healthcare workers with limited English language proficiency or low literacy. So as I said, these are some of the kind of guiding principles that we've used and that we kind of do. And we're going to continue to test and learn from new materials as we create them. And later on, I'll share a little bit more about that. But now I'm going to turn it over to our other presenters, Dr. Abby Carlson and Shay Drummond from CDC, who will share more about the learning products that CDC has already developed for Project Firstline.
Thanks, John. And we can go to the next slide. And one more, please. So we'll start with this. This is a new video. It's called Recognizing Infection Risks in Healthcare. And this really is an effective jumping off point for setting the stage for the Project Firstline paradigm. And it teaches and shows the basic ideas behind that risk recognition, which we've talked about in previous echoes and webinars, where germs live and how infection control in healthcare is a very important way to protect your patients, yourself, and your coworkers. And as an infection preventionist, I really appreciate this video because it can be used with a broad audience in the healthcare setting, and you're laying down that same message for everyone. And it really is, to me, a really foundational piece to build upon for all the other Project Firstline materials and trainings that you can build off of. Next slide. I'm excited about our new web pages. This is an example of some of the graphics and the layout that you'll see. They're very user-friendly. They're easy to navigate. They house our new materials, and they bring the training to the healthcare workers. As John pointed out, we need to give them that training at their fingertips and on the go. They need to be able to grab it in a few minutes that they might have on a break, or maybe as they're driving into work and thinking about what their day's lined up. So I encourage you to go and check these out. Next slide. Training toolkits. These are awesome. If you have 10 minutes to do a training or 60 minutes to do a training, these are easy to put together. They provide all the materials and outlines for you, the facilitator. They have materials for the participants that are taking the trainings that you can share in advance. They have PowerPoints, slide materials, videos, even assessments that you can do to gauge the effectiveness of these training toolkits. And what I also really like about these, it's a wide variety of subjects. So I really encourage you to go in and browse because they range from PPE. There are several on viruses. There are, one on multi-dose vials and injection safety, which is a hot topic. So it's really a broad topic range. And they're, again, something that you can use in any of the different frontline healthcare environments, or you can tweak it and piggyback it onto another training that you're already tasked to do. So again, from the IP side, these are easy grab and go packages. If your job and responsibility is providing training resources, and for health educators in our healthcare systems, I think they would very much appreciate these formats and the accessibility of putting together a quick training just in time. Next slide. Oh, the posters. These are really fun and vibrant. I think they're only limited by your own creativity, or if you have IP restrictions in your facility about hanging posters, you may want to check those out before you slap them up on the walls. But these are great to layer the content, and they give the strong visual reminders that are great in the moment to just really build on the continual educational process that we are providing. A few effective areas I've seen these used are around huddle boards, in break rooms, even stall readers in bathrooms. I've seen them effectively used there as well. So they just give that visual reinforcement of those messages that we're trying to hit home every day, so that that's all becomes second nature, and they can be really good opportunities to spark discussions if you're having a quick morning huddle. So next slide, and over to you, Abby.
Thanks. And I'm going to run really quickly through these, in part because we are going to have larger discussions about how this integrates into the topic of this presentation in just a couple of minutes. But we also have a number of infographics on reservoirs. So for those who have seen the reservoir presentations, these are more detailed treatments that we've gone through with you. But when it comes to emerging and re-emerging infectious diseases, you know, often it's really about going back to basics. And so monkeypox is a great example of this. It's really about germs can live on the skin. And in this case, monkeypox actually, you know, lives in the pustules on the skin. And if you start there, you can use these sort of very basic tools to address a very new or re-emergent disease as it is. So infographics, we've got a lot of these with a lot of details. Next slide. Same for, we divide them into body and environment. So these are the environment ones, but they're all found in the same place on our website, which Alyssa has noted we will share. Next slide. For those of you who are in roles where you're going to have to do communications campaigns and going on the lines of the posters, we have animated GIFs that you can include in emails, social media posts, and you can actually print them off and make them into posters. Lots of other ways you can do this. So we provide some of that for you as well. And next slide, please. And then again, social media, we have some social media items. Can you click, Sophie, on the yellow, or whomever is doing the slides, on the yellow rectangle there, see if it will play for us. It may or may not. Yes. So some of these are like little social media silent videos that share facts about healthcare and infection control. So again, for people who are working on wider communication campaigns as they respond to an emerging infectious diseases, often getting back to the basics and talking about, you know, what is needed as basic infection prevention to prevent the spread of most all infections. So a lot of resources on that end. Next slide. All right, and then the what's next part, I'm going to turn it back over to John for that to start.
Yeah, if we can just go to the next slide. Just to say that we'll continue to work on our audience engagement. We're reviewing feedback on all of the current educational resources described today to try to learn from that. We'll be conducting new focus groups and literature reviews to inform development of some new resources. And then, you know, we're also currently doing some work to collect feedback on Project Firstline website, and as well as kind of testing new educational resources that are in development. So continuing at each phase to include, you know, our healthcare worker audience and get their feedback and insights.
And from Abby and my standpoint on product development, we're continuing to work on new online learning modules. We have a whole series of what do you do when you see blank, that could be blood. What do you see when you see diarrhea? We are creating some very cool job aids that we have one that's going to be rolling out pretty soon that I think many in infection prevention and environmental services will really appreciate when it makes its appearance. And then again, expanding that web content and putting out some new IPC basics that are just little snack bites and tidbits of little nuggets of knowledge. So next slide.
All right. So that's coming back to me now. Sorry about that, panelists. All right. So now we provided a space for you to ask any questions you have to our panelists today. If you have a question at any time during the discussion, please feel free to add it in the chat or unmute yourself and ask. We will now stop sharing our screen in order to better engage with you all. So keeping in focus with our theme today, Kawi of Gathering, please feel free to ask any and all questions while you have our panelists here available. All right, let's see. Dr. Carlson, I have a question for you. For folks who may not be aware, what are emerging and re-emerging disease threats?
Sure. So the definition can be a little bit variable and it kind of depends on your perspective. But an emerging infectious disease is one that hasn't been seen before. So COVID-19 or the SARS-CoV-2 virus would be an emerging infectious disease. Even if it doesn't cause a pandemic, and many emerging diseases actually don't, it can still be an emerging infectious disease. A re-emerging infectious disease implies that there has been sort of a period of to use a technical term, quiescence. And that can be either a disease that breaks out in sporadic outbursts and then kind of goes away, which is the trend for something like Ebola. And so it re-emerges in various places around the world. Or for monkeypox, you know, in some countries, for some people, it's a re-emerging disease. And what do I mean by that? For Africa, monkeypox is somewhat endemic, and Africa is a big continent. So really, we're talking about a few countries within Africa where this disease is seen commonly. And then for the rest of the world, we see it very rarely. So there was an outbreak many years ago related to prairie dogs who were kept as pets. And so you would call that a reemergence within the United States. It's not that it's brand new to the globe, but rather that this is reemerging in a place that doesn't usually see it often, or where it hasn't been present for many years, or has been present at very low levels. So you can see that perspective on this matters. Where you are in geography and time makes a big difference as to whether or not something is emerging or re-emerging. And that's how I begin to think of it. I think the last thing I would say about it is, you know, again, and you're going to hear me hit this home many, many times, but even when things are re-emerging or emerging, often there are basic principles of related infections. So coronaviruses for COVID-19 and SARS-CoV-2, of the orthopox viruses for monkeypox, that we can say, okay, this family of viruses behaves a certain way, and that's where we begin our infection control thinking, and we move from there. So it's not like you start off with zero knowledge just because it's a brand new thing.
All right, great. Thank you very much for that, Dr. Carlson. All right, let's see if we have any more questions. All right, I got one for you, Karen. What kinds of infection control information are important for UIO staff and other frontline healthcare workers to have during these emerging and re-emerging disease threats?
Thank you for that question, Kyle. And Dr. Carlson was exactly right that wherever you may be, being alert to the possibilities of infection is the key here, and how training is effective is where it can build upon that information that we already have on infection control actions that we know very well, like masking and hand hygiene and PPE use. But in this particular project cycle, we learned about infection risk recognition. And so with monitoring of the body environment reservoirs, we learned how to remove those pathways by which germs can spread with the infection control actions that we know very well. And these were the requests for information that would be useful for UIOs that was shared with the NCUIH team. And this effective training is successful if we can even stop one infection from occurring in our staff or in the community.
All right. Thank you very much for that response, Karen. I appreciate that. And thank you very much for our panelists and to our audience for that wonderful discussion. We will now resume sharing our presentation. All right, next slide, please. All right. Next slide, please. Okay. All right, now we have a brief cultural commentary. Next slide, please. Okay, today's cultural commentary will be provided by Marie Zephyr and Zoe Harris. So now we will stop screen sharing again to allow you to better engage with Marie and Sophie. With that, please take it away, Marie and Zoe.
Hey, Mitakiapi, my name is Marie, and I'm really glad to be here today. The Comanche word for hua means to gather, and as Indigenous people, we really have diversity in our cultures that could be applied to these values we have also in our infection prevention efforts. I wanted to ask Zoe, my Wopnok sister, if there's anything in her culture that might apply as far as concepts and being a better relative when it comes to infection control.
Yes, thank you, Marie. Winnie-Kisa to everyone. So in the Mashpee Wampanoag culture in Wampanoag, we have a word that's Sonkushk, and it means an individual who's entrusted to carry out the will of the people, or one who carries a deep sense of responsibility to ensure the well-being of the whole. And I think as it relates to emerging and re-emerging diseases, we all have a responsibility to be aware of infection control, but it's also really helpful to have an individual who we can trust to give us relevant information, which is why I think it's really great that we have UIO leaders and employees here so that they can bring this great information back to their organizations and their wider communities. So thanks. Are there any similar concepts in your language, Marie?
Definitely, Zoe. Well, in Lakota, we call it Mitakiase, how we're all related. And, you know, in relation to the diseases and re-emerging diseases, we could also use that same concept and recognize that we could be better relatives to one another by just sharing information and taking precautions that are best for our health.
I absolutely agree, Marie. Like you said, there's so much diversity within our tribes and our communities, but we also share a lot of values that can be woven into our work. And I think it's important that we really keep that interconnectedness in the forefront of our minds, especially as we think about UIOs, which have such diverse tribal communities. So thanks for chatting with me, and we will turn it back to Kyle.
All right, thank you very much, Marie and Zoe, for that wonderful commentary. We're now going to resume our presentation and wrap up today's session with some reminders. Next slide, please. We'll get going. All right. Okay, resources. Here are some key Project Firstline resources that were discussed today. These links will be shared in the chat as well as emailed to you following today's event. All right, next slide. Okay, have you heard of NCUI's Project Firstline podcast? You can listen to the NCUI Native Healthcast by scanning the QR code here or visiting the link provided. Next slide, please. All right, we hope to see you at future NCUI events, so you can visit our website to register for upcoming events. Next slide. Okay, and here are some references from today. All right. Okay, and last but not least, finally, please take our survey to help us improve our events. As a reminder, those of you who have completed the survey will have a chance to receive a token of appreciation from NCUI in the future. We really value your feedback. We'll stay on this slide to end today's session. Thank you all for joining us today. We hope you all have a good rest of your day and hope to see you in the future at Project Firstline events. Thank you, and thank you for being here and attending today's event, and And hopefully these resources and information will help you and your organizations and get to where we need to be with the training and identifying emerging and re-emerging threats. Thank you.